self-talk is a way of reorganizing your brain. So your brain has the ability to change, and this is called neuroplasticity. That's the great hope we have about all of this, that the brain can change.
I think the really key point is that you're talking about the anxiety sensitivity index, and you think, okay, well, one of our listeners maybe have experienced a trauma and say, well, my neighbor, had the same thing happen, and she, we were in this together and same situation, et cetera, but total different reaction, coping, behavior results. And the question is, okay, well, why me? And I know that there are genetic predispositions, like we've looked at with Navy SEALs in the water dunking test. Okay, dunk a Navy SEAL, a Navy diver, and to the point of passing out. And those that come up and say, hey, I want to do this again, like, okay, on you go. The ones that are like, heck no. And then there's a genetic link to that type of behavior, certainly. So we can have some association there, and also noting that sometimes it's trauma upon trauma upon trauma, like this is the icing on the cake, and or the physiology, the hormonal balance is off. One thing that is really significant is what I've looked at with the research I've done is looking at the resurgence or the difficulty with the times of our life when we have significant hormonal changes, when we've had a history of past trauma. So we've seen the research in veterans, women veterans, for example, with a history of childhood abuse or sexual abuse, having a much more significant, or veterans who have been in a war, having a much more significant difficulty in the menopause with increased depression, increased anxiety during this time of hormonal fluctuations, and then postpartum depression. Is there an increased link with that drop of protective? And I believe it's also linked to the protective effects of progesterone. And now that's depleted during this time, or with chronic ongoing stress, progesterone levels are depleted. So we have less of a physiologic cushion as well.
Absolutely. Just to comment on some of the things you said, the first example you used of dunking the Navy SEALs underwater is actually, there's one of the things that's quite fascinating about that is that they've recently started to do brain-based interventions with the Navy SEALs. And they find that when they teach them how to regulate their amygdala activity, they teach them that there's an anxiety center in your brain, and that's called the amygdala, and this anxiety center is actually blasting through your brain and the rest of your body, but it's causing you to freeze or fly or just want to get out of that situation. They teach them how the frontal cortex, which is your thinking brain, can actually connect with the anxiety center, and by learning techniques to turn your frontal cortex back on, you can turn off this anxiety and actually withstand the strain of pool comp, which is what that dunking test is called. So it's cool that they've used it, and they've shown a significant shift in the number of people who will pass pool comp just by using brain-based interventions. So when we get to talking about that, I'll mention what some of those interventions are, but just want to say that I think that's a great model where we can see that such a highly strenuous activity which most SEALs generally fail, you can change the outcome by thinking differently. And I think overarchingly, one of the things I think we're talking about is we're talking about biopsychosocial, and we're talking about hormonal changes and changes before pregnancy and changes after. I'm sure at the back of people's minds is this question of, well, how do I do this? Like, are you telling me I should just talk to myself differently or think differently? And yes, I am. And I think one of the things I took this for granted for the longest time, that people just knew that this was the case. But I'm going to say explicitly that self-talk is a way of reorganizing your brain. So your brain has the ability to change, and this is called neuroplasticity. And because it has this ability to change, either therapy or self-talk or hormonal treatments or different foods or medications can actually change your brain structure and functioning. So that's point number one. That's the great hope we have about all of this, that the brain can change. I think point number two is that you can change the brain with self-talk. So I'll give you a classic example. If you say to your brain, say you're in a tough situation, you think, you know what, I'm really going to beat this. If you say, I'm going to crush this, it's less effective than if you say you're going to crush this. So there's a study that's actually looked at this and shown that people who treat themselves in the third person are actually more effective in increasing their confidence to be able to carry stuff out than people who say, I'm going to crush this. So when you know a simple fact like that, it's like, wow. So when I talk to myself, I should be like, you know what, when you say to yourself, you go girl, you're actually giving yourself a more effective instruction than if you say, I'm going to do that. And I think what a lot of people don't realize is that this and other forms of self-talk, and you tell me when you want to talk about what forms of self-talk, but this and other forms of self-talk can actually change the way in which your brain is structured. And we now have a tremendous number of studies that point us in the right directions about what kind of self-talk can help. And as you know, Anna, I was just talking to Anna about this earlier and was saying that, you know, after you have that much experience of what we do, I think you recognize that you don't want to create false promises for people. You don't want to say, oh, use this because everybody uses it and it's going to work for you. But what we can say is that we have very well-researched systems, scaffoldings that we can give to people, and that people can then take those scaffoldings and make it applicable to them. So in the cases that you're talking about, you know, yes, there is an association with premenstrual effects, but it also is going to be different for someone who has another partner's support versus someone who doesn't. And it's going to be different for someone who has a mortgage payment that they can't pay than for someone who doesn't. So for every human being, there's a complexity. I really think that sometimes people think, oh my God, this is so much information, I can't do this. If you start with the scaffolding, that's a great way to begin. And then you build on that little by little until you can actually manage yourself. And studies do show that a lot of the changes that you were talking about are changes we can reverse simply by changing our perspective on things so that your brain views the world differently.
No, I love that. And I love what you said is that, you know, the speaking to yourself in the third party, but is that the same as like the royal we, like we are, you know, would that work the same way? Because you think of that, the royal we, and I'm wondering.
No, I think the royal we is not really taking any ownership for anything. So whereas when you're saying you're personalizing it to the person that is you. And I think part of why I think that happens is that paradoxically, I think if you were, you know, there's a lot more to say about first and third person. I don't want to complicate the thread of our conversation, but I'll just say that I think first not taking the diagnosis that seriously in the sense that you let it limit you, and then secondly, recognizing that there are these biological, psychological, and social dimensions, and then thirdly, know that exactly what you were saying, which is that some of these biological dimensions involve hormonal changes that create real vulnerabilities for people. Different people have different sensitivities, and you can change your brain simply by changing the way in which you talk to yourself.
Are cravings your downfall? This is truly typical of anyone trying to lose weight. Let me tell you, willpower is physiologic. Just like Francis discovered, the Keto Green Shake Mix is a tasty and nutritious way to replace a meal while helping you feel full longer and giving you the nourishment, vitamins, minerals, protein, fat that your body needs. So cut your cravings, boost your energy, and improve your overall fitness with the Keto Green Shake Mix. Find Keto Green Shake at dranna.com and use the code SHOW10 to get 10% off your first order risk-free. Thank you for watching this video. Be sure to subscribe to my YouTube channel here and get those notifications, and comment below. Let me know your thoughts, what you loved, and what your action step is.